Hey everyone, Ali here. So as the temperatures have dropped and it's been pretty cold and frigid around the country, the Department of Labor decided to give us one more thing to deal with. Although we were expecting this for some time at the end of last year, it was delayed until January 9th. And what the Department of Labor did is they set out the criteria for determining whether a worker is an independent contractor versus an employee. Okay, and the way they did it is they basically rescinded their rule from 2021 that had a 2-factor test, and they expanded it to a 6-factor test. Now, what's important to know is that all of these factors that I'll summarize in a second are going to be weighted equally. Now that's very important because the previous rule and many state rules don't weight these things equally. And so you just kind of never know where their focus is. But these are going to be weighted equally, and that does help us in our analysis. Now, what are the 6 things? Well, first is control. Does the employer have control over the worker's work, how they perform their job? Okay, so that's number 1. Number 2 is there an opportunity for profit or loss for the worker? Okay, again, hugely important. The first 2 that I just mentioned, control and profit and loss, are the same as the 2021 rule. Now, number 3 is the amount of skill or initiative required for the work, right? Is there increased initiative, increased skill required for them to do the work? So that's criteria number 3. Criteria number 4 is the permanence of the job, or the working relationship. Is this something that's more part-time and more focus on a short period of time, or is there a 1-year contract, 2-year contract, or whatnot? Is it more permanent than not? So that's number 4. Number 5 is, does the worker invest in specialized equipment, supplies, all those things? Are they bringing in their own specialized equipment or whatnot? That's an important part of this as well. And then finally, number 6 is how much of the services that are rendered, how much of that is an integral part of the employer's business, okay? The more integral it is, the more they're going to be deemed to be an employee versus an independent contractor, okay? And it's going to be a problem for many of you who have independent contractors, because of course in your practices you're most likely going to make your associates the independent contractors, and of course they are providing services to your patients just as you would be providing services to your patients. So that's an integral part. Now, what does this mean for you? What should you do now? Well, a couple of things. If you have independent contractors that are working for you and you are risk averse, you don't want the IRS or the federal government or Department of Labor or the states to come after you, it's really important that you update your contracts and you change your independent contractors to employees. Now, I know that there is an increased cost of taxes and otherwise, but there are strategies that we can discuss to minimize those costs, to allow you to, more or less not be out of pocket any more than you currently are. So we can do that, and that is sort of one thing. If you're in a state that already has rules regarding this, if your state rules are more strict than the Department of Labor rules that I just summarized, right? They're more strict, then you have to abide by your state's rules, okay? Because they're more strict. If your state has more lenient rules regarding this, or if they don't have any rules at all, right? They allow independent contractors or whatnot, then you have to follow the federal rules starting in March, okay, March 11th. So what should you do next? My recommendation is update your contracts. It's not worth the risk and the audits, because once they audit you for this, they can audit you for a lot of other things. So if you want us to redo your contracts for you, we'd be happy to. If you're an HR for Health customer, you get pretty significant discounts on that. If you are not an HR for Health customer, would be very happy to kind of get these done quickly for you. Just let us know. We're doing hundreds and hundreds of these right now because of these, not just because of this rule change, but because of some other law changes as well. But if you have any questions, please reach out. I'm always here to help, of course. Again, this is a very important rule change that's coming up in March, so please make sure you're on top of it. Thanks.